There are two types of breast reconstructions, which could be either implant-based or something called as autologous reconstructions, which means we use your own tissues to make new breasts for you, and which has its own advantages in the long term. And of course, we offer nipple reconstruction as well, as the what we call the cherry on the top at the end, when to get that complete feel of a breast again. And we also have an excellent physiotherapy team here who are doing lymphatic drainage and further management if you were to develop lymphedema as well. So in conclusion, the Breast 360-degree is not just a clinic, it is a commitment to comprehensive, compassionate and contemporary breast care. And I'm really, really proud to be a part of this initiative, and we look forward to the difference it will make in so many lives in the future. And finally, I would really thank Dr. Narayani Ma'am, our Zonal Director, Dr. Berry, our Facility Director, and Ms. Rinku Bhavani, our Business Head, for making this initiative being so strong and so committed that we finally arrived, and hopefully things only can get better from here. Thank you so much.
Thank you, Dr. Rachana, for explaining the concept, scope and key offerings. I would like to now invite Dr. Sonali Maniyar, a senior radiologist with over 25 years of experience. She specializes in breast imaging, focuses on early detection and further diagnosis with sonography and biopsy. Radiology is often the first step in the breast care journey. Breast Care 360 offers dedicated breast imaging under one umbrella. Over to you, Dr. Sonali.
Thank you. It's firstly a great privilege to be part of this Breast 360. So thank you, Dr. Berry, Dr. Narayani, Dr. Supriya and everybody in the team. Namaskar. So radiology department is ब्रेस्ट केयर 360 का महत्वपूर्ण कड़ी है. हम एक्सपर्ट रेडियोलॉजिस्ट और हमारी जो भी नई फैसिलिटी जो एडवांस्ड मशीन्स जैसे कि डॉक्टर बेरी ने बताया, द न्यू मैमोग्राफी, डिजिटल मैमोग्राफी, 3 टेस्ला MRI, इन सब को जोड़ के हम ब्रेस्ट कैंसर पेशेंट्स के सफ़र में डिटेक्शन से लेके फॉलोअप तक जुड़े हुए हैं. सो अर्ली डिटेक्शन एज वी नो हेल्प्स इन बेटर आउटकम्स. और डिटेक्शन कहाँ से शुरू होता है? वो रेडियोलॉजी से शुरू होता है. वन ऑफ द मेजर थिंग्स इज दैट ब्रेस्ट कैंसर कैन बी स्क्रीन. स्क्रीनिंग मतलब कोई भी डिजीज़ के लक्षण आने से पहले हम पेशेंट का ये डिजीज़ पिकअप करते हैं. सो स्क्रीनिंग इज़ अ वेरी इंपॉर्टेंट टूल फॉर ब्रेस्ट कैंसर. इससे हम आमतौर से हम मैमोग्राफी करते हैं अकॉर्डिंग टू इंटरनेशनल स्टैंडर्ड्स 40 एज के अबव की महिलाओं को करते हैं. बट वी ऑल्सो हैव अ जेनेटिसिस्ट हु गिव्स अस इंडिविजुअल रिस्क्स. सो इससे हम एक पर्सनलाइज स्क्रीनिंग भी सब हर पेशेंट को दे सकते हैं, जिसमें अगर सोनोग्राफी, मैमोग्राफी या कभी कभी MRI का भी इस्तेमाल होता है. यंग पेशेंट्स जो हाई रिस्क पे होते हैं हम उनका MRI भी करते हैं. सो वी हैव अ स्पेशल MRI coil, dedicated breast coil, and एक्सपर्ट रेडियोलॉजिस्ट हु कैन रीड द सेम. फिर आता है कि अगर इसमें मैमोग्राफी में कुछ दिखे तो क्या करना चाहिए. आगे सोनोग्राफी, बायोप्सी, वो भी हम डिपार्टमेंट में करते हैं. MRI करना पड़ता है ताकि हमें पता चले कि ये ट्रीटमेंट काम कर रही है या नहीं कर रही है. अब जब पेशेंट स्वस्थ होके घर जाते हैं फिर भी आते हैं फॉर फॉलोअप्स टू आवर डिपार्टमेंट 6 महीने में या 1 साल में. सो इस तरह हमारा डिपार्टमेंट पेशेंट के पूरे सफ़र में उनके साथ है, राइट टिल द एंड. थैंक यू.
थैंक यू डॉक्टर सोनाली. आई थिंक आपने बहुत अच्छे तरीके से प्रोसेस एक्सप्लेन किया है. आई थिंक मेनी ऑफ अस वर नॉट अवेयर ऑफ दिस, सो थैंक यू सो मच फॉर द क्लैरिटी एंड वैल्यूएबल इनसाइट्स. I would like to invite our next speaker, Dr. Raj Kapadia, Surgical Oncology and Early Detection. He is skilled cancer surgeon specializing in innovative minimally invasive approaches, including robotic surgery, for treating a wide range of complex tumors. He received his advanced surgical training at the prestigious Tata Memorial Hospital, Mumbai, a renowned cancer center in India. Dr. Raj, over to you.
Thank you so much. Very good morning, everyone. All gathered here to, you've taken out time for us and to hear us out. So it's a very important initiative which the hospital has taken forward. All thanks to Dr. Narayani, Dr. Vikram, Dr. Vishal, and the facility here, everyone here. So main idea of the clinic is actually to start कि हम एक जल्दी early detection of cancer करें, because I have still see a lot of patients who are coming with advanced breast cancers, in fact who had their mothers, their sisters having cancers, and who अभी भी they are trying to delay and trying to get away from the reality, not come early to the hospital, and then coming with advanced diseases which are difficult to manage. उसको treat करना भी difficult हो जाता है. बहुत सारे अदर ऑप्शंस ऑफ थेरेपी भी लगते हैं, जैसे कीमोथेरेपी, रेडिएशन, सर्जरी. द ट्रीटमेंट बिकम्स मोर कॉम्प्लेक्स. सो वी आर जस्ट फोकसिंग इन विद दिस क्लिनिक ऑन अर्ली डिटेक्शन, अ पर्सनलाइज्ड पेशेंट केयर. सो दिस ईयर्स WHO theme is united by unique. So every patient has its own unique journey of cancer. उसको हमें एज अ पर्सन ट्रीट करना है, नॉट जस्ट लुकिंग एट हिज और हर कैंसर. सो द इम्पॉर्टेंट स्टेप इज टू फर्स्ट आइडेंटिफाई द पेशेंट, फाइंड व्हाट इज द नीड ऑफ द पेशेंट एंड देन ट्रीट द पेशेंट अकॉर्डिंगली. ना कि हम एक तरीके का ट्रीटमेंट सब पे लागू करें, which was happening 10-15 years down back. So when the surgery for breast cancer started, एक मशहूर वैज्ञानिक है डॉक्टर हल्स्टेड, he started the surgery of he described first the surgery of breast cancer. तो तब the surgery was very aggressive. हम बहुत सारा टिश्यू निकाल देते, पेशेंट को एक बड़ा वूंड होता और बहुत तकलीफ होती. And starting from that point coming to today, the surgery has gone lesser and lesser. How can we give a good quality of life as well as at the same time take care of the cancer as well? So the focus is now on quality of care along with breast cancer. अब ऐसे जो ब्रेस्ट कैंसर भी बहुत तरह के टाइप्स है और हर एक टाइप का एक अलग तरह से हमें ट्रीटमेंट करना होता है, ना कि हम हर कैंसर को एक ही तरह से ट्रीट करें. सो इन दिस वी हैव अ लॉट ऑफ एडवांस टेक्नोलॉजी which is used, which the hospital has been very kind to provide us with, and all put together, like Dr. Maniyar said, it's very important that her team and she does a good job in detecting them early. बिकॉज जब तक हम पकड़ेंगे नहीं तब तक हम ट्रीट नहीं कर सकते हैं. सो अर्ली डिटेक्शन इज़ वेरी वेरी इम्पॉर्टेंट. बहुत सारे लोग अभी भी मैमोग्राफी एज अ रूटीन स्क्रीनिंग टूल नहीं यूज़ कर रहे हैं. सो वी हैव टू गो देयर आउट इन द कम्युनिटी, उनको बताना है ये चीज़ कि इट इज़ वेरी वेरी इम्पॉर्टेंट दैट ब्रेस्ट कैंसर स्क्रीनिंग हो. India is going to have an epidemic of cancers in the next 10-15 years. They are going to be the world cancer hub. So it's important that we reduce the burden of treatment by catching them early, not waiting till it becomes advanced and when the therapy becomes very complex, time consuming and very costly. I also want to put a little focus on that. As in the treatments options are coming, the cost of treatment is going up. I think everyone needs to get insured, and we should push for patients having insurance, families taking insurance, so that in time of need the care is not compromised and they can have everything which is world class, which is available in our hospital to offer. So summing up with also Dr. Rachna said, yes, so previously the females were not so body conscious. They would have their family members taking a decision for them. Now I think the times are changing, but I still see a lot of patients coming, they'll be like, okay, take the decision with my husband or with my brother or with my son. So that awareness is still lacking, especially in women, that they are not, उनकी जो अपनी बॉडी की एक इमेज है, वो इमेज को वो पहचाने and उसके हिसाब से उन्हें क्या चाहिए वो डिसीजन ले. So that's always been our focus at the hospital as well, that we talk to the patient and not to the relatives. We tell them these are the options available, and you can have the breast as normal as it was before having cancer. So that's where Dr. Rachna makes an important part in our team, where it's very important that we in today's era not do surgeries which were 10 years done back. We come forth with the cutting edge things we have. We do as less as possible. Like I said, the focus is on quality of life.
I request journalists to kindly introduce themselves and then their publication before asking the questions.
Hello, myself Babita from Times Global News. My question is, why did Fortis feel the need to launch BreastCare 360 health initiative at this time?
So, like we said, up until now, all this treatment was fragmented. So, a lot of hospitals have all these modalities. What we've tried to do is put it all under one roof. So, if you look at it from the patient's point of view, many times they don't know what to do. So, one is when you're diagnosed with something like this, understandably you panic, you don't know what to do next. So, the idea here is instead of hunting who do I show, we have one point, one stop, which would be, for example, Dr. Rachna or Dr. Raj, who would then guide you through the rest of the process. And then you don't have to worry that sometimes what happens is ye test yahan nahi hota, this you'll have to go elsewhere. Again, that causes a lot of trouble to the patient in that situation. So all of this in one roof, and instead of splitting it into different silos, it is all under one common umbrella. From the treating team, again, it's a team and it's not one individual doctor. Many times you showed 3 different doctors, you get different opinions. So the right way to do it is collectively decide that this is the best thing for the patient, and we do that. So that is the idea behind this clinic.
Thank you. And is this health initiative launched in one Fortis location or across multiple centers?
So for now it is here at Mulund, but over time we will now start offering. In fact, the basic blocks for this is available in all the units. We will put it together, and actually in a short period of time you will have it across all units that we have.
Thank you.
This is Sachin from Global Prime News. My question is to Dr. Rachna. Why is breast reconstruction an important and integral part of the breast cancer care?
So I think as times are changing, women are changing. It's just not about getting that aesthetics back. So once you go for a surgery, you want to come back looking as normal as possible. And there have been studies done which have shown great physical and emotional, psychological, well-being getting positively impacted for this woman. They have to get back to work nowadays. So like they have another 40-year-old lady who's diagnosed with breast cancer, has another 40 years to live. And she has to mingle with the society and at the same time feel confident inside out. So that is the reason I think we are giving that option, which is probably very much in the Western world, but I think steadily we are, the numbers are going up heavily in India as well.
And is there any AI and robotics associated with this latest trends in breast cancer reconstruction?
That's a very good question, actually. So robotics, I think probably Dr. Raj could answer this well, but we started doing it in mastectomies as well, with the help of these things. And in the Western world, with regards to breast reconstruction, there has been introduction of robotics as well, which means in some cases like you're doing autologous breast reconstruction, which is using your own body tissues. What happens? The advantage being that patient gets a quick recovery. So, 10-20 years back, they used to be in the hospital for 10 days post-op. But now I aim myself here at 3 or 4 days. You try to go home after a major procedure, and probably with the introduction of robotics and less incision surgeries, hopefully you can aim at day 1 and 2 as well in the future.
Great, thank you.
मैं नौबारा से हूँ दयाशंकर सर केयर 360 में एक बैनर के नीचे आप उसका डिटेक्ट कर रहे हैं ट्रीट कर रहे हैं इसे कॉस्ट कटिंग को लेकर कुछ फायदा मिलेगा क्योंकि कैंसर एक ऐसी चीज़ है लोग डर भी जाते हैं कॉस्टली भी होता है ट्रीट जल्दी नहीं होता है कॉस्ट कटिंग को लेकर क्या है स्पेशल कुछ है इसके फायदा क्या होगा
सो कुछ हद तक होगा लेकिन जैसे डॉक्टर राज ने भी बोला जब नई टेक्नोलॉजी आती है सैडली जब टेक्नोलॉजी इंट्रोड्यूस होती है तो प्राइसिंग थोड़ा ज़्यादा होता है ओवर टाइम कंपनीज भी प्राइस नीचे कर देते हैं वॉल्यूम्स एक बार होने लगे तो प्राइसेस अपने आप नीचे आ जाती बट द सेविंग इन दिस विल बी टू वन इज you will not have to go to 10 different people, you will come to one common thing